My name is Alicia Bell, and I have the pleasure of serving as president of Unite LA. I want to thank you again for joining today's important webinar. We have an outstanding lineup of phenomenal leaders who are gracing us with their time and their wisdom today. And I appreciate the great lineup of speakers and all of you for participating. Also, want to give a shout out to our sponsor, First 5 LA. And I really want to thank the business associations that partnered with us to promote today's webinar to their networks. So I want to thank the Pomona Chamber of Commerce, the San Gabriel Valley Economic Partnership, our friends at the Sierra Business Council, the Simi Valley Chamber of Commerce, our friends over at Small Business Majority, and of course, the Vietnamese American Chamber of Commerce. And before we launch into today's conversation, I just want to share a little bit about Unite LA for some of our newer partners on today's webinar. For 27 years, since 1998, Unite LA has existed to advance equitable economic mobility. We were originally co-founded by the City of Los Angeles, LAUSD, and LA Community College District. And Unite LA has always been laser focused on collectively breaking barriers alongside individuals from historically marginalized communities. As we are all processing the early impact of our current federal administration, it is clear that community engagement and collaboration with partners is more important than ever. And so Unite LA is really working to double down on collaborative efforts focused on strengthening systems, policies, and high quality education and career pathways that support and empower our diverse and rising workforce here in Los Angeles. Today's conversation on early care and education comes at a really pivotal point for our state and for our nation, which of course is in the process of recovering from the longest government shutdown in our history. Our state must also grapple with the implementation of H.R. 1, which will cut access to critical public benefits programs such as Medicaid, Medi-Cal, and SNAP to millions of families. And many of these are the same families that are leveraging childcare subsidies. For today's agenda, we are really honored that we have Assembly member Cecilia Aguiar-Curry joining us for a conversation, which will be facilitated by Unite LA's Director of Education and Workforce Strategy and Policy, Kelly Reynolds. Kelly will then moderate a discussion with Bianca Blomquist, California Director of Small Business Majority, and Donna Sneeringer, President of Child Care Resource Center, who will discuss the business and economic impacts of childcare. So in closing, thank you all again so much for sharing some of your precious time here as we approach the holidays with us. And I will turn it over to my colleague, Kelly.
Thank you so much, Alicia. I'm excited to welcome Assembly Majority Leader Cecilia Aguiar-Curry for a candid conversation about the state of early care and education in California and how we can work to protect it, as well as continue to support increasing access to high quality care across the state during these tough times. Majority Leader Aguiar-Curry is the chair of the California Legislative Women's Caucus and the chair of the Assembly Select Committee on Child Care Costs. She's been a champion for childcare throughout her time in the legislature, and we're really excited to have her join us today. Majority Leader, thank you so much for being a part of this conversation.
Oh, thank you very much, Kelly, for having me today, Alicia, and everyone else that's here, and Donna. I appreciate the opportunity to chat a little bit about childcare and kind of what a vision we're going to all have this next year and going forward. And so I appreciate your time. So let's go for it. Let's see what's going on.
Thank you. Well, to say that there's a lot going on right now in our state and country would be a little bit of an understatement. Given these unprecedented times, how are you doing, whether that's personally, professionally, and what are you most focused on these days?
Well, let's put it this way. It was a really tough year. And I took it not only out of myself, but all my colleagues. And, we're still working. We're still doing the job that we all signed up to do and that we love. But these are tough times. And conversations with my colleagues have been difficult. like where are we going? How are we going to work with the federal government? What are the impacts that are going to happen to our communities? So it's just really helpful that we all know we're going to continue to fight the fight and to make sure that we're taking care of our working families, because that has been one of my most important things that we've done and we will continue to do. Affordability will always be at the top of the line for me, and helping families be able to go to work, care for their kids, and stay afloat. So that's something that we'll be working on. You know, as we know, as the families can't afford care, they can't go to work. And if they can't go to work, then everything else starts to crumble around them. And I've always said to people, and people have asked me this numerous times, what's so important about childcare, and is that I'd love to see the whole child be able to be successful. And families have their ups and downs, but we should be there and have support systems for families. And so it's very heart-wrenching at times. I'm really happy that we worked with the governor, because as the chair of the Women's Caucus, and, you know, I was a working single mother. I know the pain that it has had and not having childcare. And I was fortunate. I had some really strong neighbors that helped me out, but that wasn't every single day. And a lot of people don't have that. So I'm going to continue to fight for childcare providers. As we know, they're the backbone of our communities and of our economy. And I worked really hard this year for the budget request to make sure that we could get our funding that we needed to fix our outdated reimbursement system for our providers. So there's a lot we've done, and we'll continue to do. And the conversations have already started of what's our next steps and how can we help our communities. I just did a couple of workshops about childcare and learned from the providers even more. So it's an incredible time. I love every minute of it. There are days that I just want to scream. So there's the personal part, but I won't, and I won't give up. So at the end of the day, my focus is very simple. How can we help families?
Mm-hmm. Well, thank you for being a champion, and also the call out to single mothers, because I am a mom of a young toddler, and I'm 7 months pregnant, and I'm solo parenting this week, and I just don't know how some people do it. So, call out to that.
Well, if I can just say something, what's important, and I've been just saying this to many times when I'm out talking to people, we've lost a sense of community. And I asked a room full of men and women of how many people know their neighbors, and only a few people put their hands up. And I think if you knew your neighbors more, that'd bring your community together, but also help you. We're in those really tough times. So, bringing back community is really important.
Mm-hmm, absolutely. Well, you've been such a champion, and it's, very much appreciated. What do you see as some of the biggest wins that you've had during your tenure, and also what have been some of the bigger challenges?
Well, I can give you the wins. Well, as the chair of the Women's Caucus, we have been really focused, as we have since I got in the building in 2016, is working on childcare. So this year we secured commitment from the government for more childcare slots and real rate reform. So that's big. We lowered the family fee so parents aren't pushed out of the system by costs that they can't meet. We stabilized thousands of providers after a pandemic so families don't lose their care. And we kept affordability front and center on every conversation that we've had. So those are things that I wish I could put my hands around more, but the fact of the matter is, when you work on big projects like this, that takes time. And then obviously the challenges, it's expensive. It's expensive, and providers are underpaid. And I think when I say providers, I also like to throw in a little bit of our senior citizens that are having a care provider to take care of them as well. There's a lot of money going out. So that's still, childcare is expensive. Providers are still underpaid, stretched to no ends. Infant and toddler care is the costliest to provide and the hardest to find. And I think we all realize that it's very hard to get that done. The budget's really still tight. The federal cuts are killing us. And the Trump era is just making it harder. And we're fighting to hold the line and protect the progress that we've made. And we'll continue to do that. I think it'll be an interesting year, having a change in governor and a lot of elections going on, I really want all my colleagues to focus on what's important right now, our families and our communities. We get tied up on doing things about my election. I don't care about that. I'm willing to take risks to make sure our families are staying intact.
Mhm. I think something that you're addressing a lot, that's no surprise to anyone, is obviously costs and affordability. Recently, in your role as the chair of the Select Committee on Childcare Costs, you've held several briefings or hearings digging into these pressing issues impacting childcare affordability. What have been some of the key learnings or takeaways you've had from these hearings, and has it led to any aha moments or identification of policy opportunities that the legislature could lead on? And also, what do you see as the next steps from some of these hearings?
Well, first of all, is that when we have those hearings, they are heartfelt. And when people come to testify and they tell their story, it breaks my heart. And you look around the room and there's a lot of people using tissues of like how they've struggled or how they've succeeded and what they did to provide childcare in their community, and how they have young people that are now gone to college based upon the opportunities that they had with good childcare. So we just are trying to, continue to keep our people afloat. And that's what you hear every single time. How do I make ends meet? Some of these providers are up 24 hours a day, basically, because if there's an emergency, or particularly when we've had these immigration raids and there's children that are out there, they go pick them up at, at their own cost. So people forget is that it's just not the childcare that costs money. It's the car that they've got to go pick up children and move them from point A to point B. And, all those things out, the insurance, their electricity at the childcare. I mean, it was breathtaking when you sit and you remember, oh yeah, they do have to use the car to go somewhere. That's out of their pocket to provide something good for the kids. So the hearing has made things really clear. Number one, rate reform and stable funding are the only ways that to make affordable for families to keep going and to make sure they're stable. And we need to keep pushing the administration. I'm going to push and I'm going to push and I'm going to push. And I think, we may have a lot more women in the legislature before you know it. And our voices are loud and we have a bullhorn. So we're going to do it.
I appreciate that. Transitioning a little bit to the other things that are impacting the state right now. We can't ignore what's happening at the federal level.
Mm-hmm.
Many are obviously sounding the alarm on the immediate impacts of the government shutdown that we're no longer in, but still are feeling some of the ramifications of, as well as the long-term impacts of HR 1, also known as I'm going to only say this once, the big, beautiful bill, just so everyone is on the same page what we're talking about.
You don't want to know what I call it. I call BBB, be a bitter bullshitter. Sorry.
There we go. Well, you said it, I didn't. So there you go.
So I get to do that. Is that okay? I'm sorry.
Yes, no, that's fine.
I apologize for those people that didn't like that.
So, the long-term impacts of that bill will have on California families. According to the Center of the Study of Childcare Employment out of UC Berkeley, 47% of the ECE workforce in California relies on public benefit programs such as Medicaid and SNAP. And of course, many of the families that also rely on childcare subsidies rely on these public benefits. What conversations are happening at the state level about what the state can do to backfill and support these families and providers who are likely going to be, impacted in multiple ways by these cuts and freezes?
There's lots of conversations going on. Do we have anything in writing yet? And I know we're starting to do our priority bills and looking at what the budget's going to look like and how do we defend ourselves along the way. And there will be some major bills I'm going to predict that are going to come out to help protect our most vulnerable people, and actually all people, because it impacts all of us one way or the other. So we just have to keep focused. And my colleagues I don't know how many times when I've been talking to them is about affordability. They'd like to change the word from affordability because it's been taken over by the federal government, and it's been our word here in the state government for over 2 years, affordability. And so now it's been kind of taken over. So we just want to protect the commitments that we have made, that we secured with our governor, and make sure that we can continue the slots, the funding, put dollars where we can do it for affordability. I mean, those are the things we're going to be working on. And with HR1, everybody is kind of on pins and needles as what's really going to happen. And I can only do this. I can keep focused. I can keep focused on how I help California. I can keep focused on the needs of my district, and my colleagues are doing the same thing. We don't mean to be selfish with our districts, but we need to keep laser clear, because what one thing works in one part of the state may not work for another part of the state. But we've got to keep laser focused, because the needs of our communities, I think when January 1 hits and people's health care is going ballooning, my phone's going to be ringing off the hook. All of our phones are going to be ringing off the hook. And we don't have, I don't think, a real clear solution. And that's what I worry about. And I'm sure many things we do. I mean, right now, I really embrace partnerships that we've had throughout the state. Our nonprofits, my God, they've been fabulous. They've risen when we're looking for food and SNAP and just doing so many things. So we have to make sure that we look for affordable options for our community. So that's where I am with the federal government. And, I really just have to keep what works for all of us right now. Good conversations are happening with our speaker. Nothing but been helpful and trying to think of solutions, as well as Monique Limon, who is now going to be our new Senator Pro Tem. I mean, we're all sitting at the table trying to think how we're going to work with or without HR1.
Mm-hmm. Absolutely.
Yeah.
I mean, I feel like you've already sort of been addressing this, but like given these cuts, I think there's also sometimes a disconnect between how things like cuts to Medicaid will impact access to childcare, or like what funding is left, to support increasing access to childcare. So what do you think can continue to try to address these affordability crises when it comes to, specifically impacting access to childcare at the state level? Like, how do you see that, over the next few years, knowing that we have, we're predicted to have deficits? Like, sort of, what are your thoughts on how do we continue to elevate that in the midst of not so great financial outlooks?
Yeah, I think the blessing that we have is that, particularly in the assembly, because I know most of the assembly members, a lot of them have families now. And when you have a family or you have an elderly family member that needs care, conversations have changed. And they used to not be open. I mean, for years, I remember when I first came on to the assembly, the conversations were not authentic. They were who can get to the highest level in the organization or whatever. Now you hear people wanting to stay and make sure what they propose gets implemented or goes forward. And so one of the things we're going to be doing this year as well is looking at policy that has happened this year or the past 5 years, and did it get implemented? Because if we can't get these bills implemented, we make a big hullabaloo and all of you are upset with us because a bill did or didn't get through. No one's asking us to be accountable. Well, did it get implemented? What do you mean there wasn't any budget? So we have to look at these things a little bit differently. And we have a good group of my colleagues, I think, that really are into affordability, making sure that we make sure everyone's accountable, whether it's ourselves, our staff, or the agencies. And do they have the funding? So there's a lot of pieces to this to make it work, and I know we can, and that's why I look forward to this next year's, because we will be doing some stuff. The speakers of, I believe, has announced, if not, here it goes, announced that there was going to be meetings on 10, 12, 15 bills to see if they've gotten implemented. And one of those is one of the ones that I do is telehealth. Is it working? Well, we know it's working. We've seen it work, but just like anything else, you only see what you see, but you need to talk to providers, you need to talk to the agencies to make sure it's even better.
I think that that's such an important point that you raise. I agree that sometimes we get so focused on just getting it passed, and it's like, well, how do we actually make sure that it works for folks and that we are making needed changes? So I think that that's a really excellent point.
Well, Kelly, you can go over to that big white building that we all sit in, or I sit in, and count, ask people, well, did that bill ever get implemented? Well, that's I don't know. I personally, and there's about probably a dozen of us that we've kind of followed each other's suit. Every bill since I started, since 2016, we review every year in October, every one of them, to see if they've been implemented. And we have found that some of mine weren't implemented by things that when I first started, I didn't realize I didn't have a budget ask. Oh, that was silly. I never did it again. But those are the kinds of things, and it's just frustrating is that we fight, we have these arguments, you see our names in the paper, blah, blah, blah. But I would love to have them say, did these bills get implemented?
Absolutely.
Yeah.
Um, I think something that's come up in this conversation or alluded to is obviously the financial crisis. And
Mm-hmm.
I think as we talk about how do we really move policy, especially when we're talking about implementation, right? A lot of times it still relies on funding to support that.
Mm-hmm.
What are your thoughts on finding additional revenue streams to support dedicated funding for childcare in California? Do you think that that would address some of our fiscal challenges that the state is facing in reforming reimbursement rates? And do you think that it's something that your colleagues in the legislature would be open to supporting?
There's been more and more discussion about how we could fund childcare all the time. There's been things of a half quarter cent tax here, a half cent here. Some cities are actually thinking of doing it on their own. So there's quite a few people having these discussions of what is the best manner to do it that makes sure we don't leave anyone behind. That's always my fear is like, okay, well, let's just throw it out there. Silicon Valley area, they can do the quarter cent tax and have childcare for their areas. So a lot of those big corporations already have childcare on site, right? But let's not forget the rural California and Siskiyou County that only have 2 childcare centers or anyone that be able to be a provider or is licensed. So we need to think how we're going to do that. So it's been proposed, doing a tax. No one likes that one. You don't want to say that word, but it could come to that. Let's see, what else have we thought of? Cities and counties are starting to look at it. So, we'll see where we all end up, but it's definitely a funding stream that we should make sure we think it's sustainable and it's not harmful to everyone because you don't, what's the unintended consequences, right? What's the unintended consequences if we ask for this money? Remember, we did the cigarette tax and now there's not that much money because not as many people are smoking, so.
Yeah. Absolutely. Well, I think it's a good conversation, and I'm glad that it's percolating
Yeah.
on
No,
how.
it's definitely percolating, and because when it affects your pocketbook, and you've got colleagues that have young children, and they're going, I can't believe, and they have jobs, and we all have good jobs, but it affects everybody, and moving a child, the things you don't think about. You might have good child care. You might have one of your children in school, and then you have a couple that are in child care, and you're moving these children from point A to point B. And how does that work affect a family and their ability to work full time? And, it's crazy.
I'm living that, so I I do understand, but I agree that it's a lot, and so I appreciate the focus on it. Last question before we wrap up on this conversation
Okay.
is, childcare intersects, as we know, with so many other pressing issues facing our state, whether it's
Mm-hmm.
economic stability and workforce participation, housing, homelessness, health, well-being, all of the big ones. But sometimes it feels like it can get deprioritized in budget conversations when it is, when we have other huge pressing issues impacting our state. So, what advice would you have for advocates on how they can be the most effective in really making childcare and investments in childcare a top priority in these conversations? And what role do you think the business community could or should be playing in some of these efforts?
Oh, you're going to get me all riled up here. I think we forget about the small business people. They have their businesses. They're small. They're usually under 50 employees. To make ends meet is so difficult for them. And to add on anything else to their plate, to add childcare, and it makes me nervous. I think that big business should help us step in with some of this as well. I think we all need to take some risks, and the risk is that we put childcare in the beginning. And how do you change people's lives? Is you make sure you give children food, a roof over their head, stability. And if you don't do that, we're making it so difficult. I consider that low-hanging fruit. My low-hanging fruit would be able to have childcare, our providers taken care of, because our economy is going to thrive. And I always get worried about my small businesses. I mean, I have 3 businesses that are one in my little town that their PG&E bill, their electrical bill, is $12,000 a month at one location, 7 in the other, and 7 in the other one. Now, how do they make ends meet and make sure that our economy stays flourishing and make sure that we have childcare? And we always put energy first. Oh, okay, that's fine, but if we don't take care of our children so our families can be healthier, that they get the education they need, and then we stop these circular thing that we're just on, yeah. So I can go on, and my soapbox is starting to fall apart right now. So,
Well, thank you so much for your time and for being here. It's been a pleasure to talk with you today, Majority Leader. And we just appreciate you continuing to be a champion. And, we'll definitely continue to elevate these issues over the next year as we, inevitably have these passionate fights that will come out in the legislature.
Well, if you don't mind me closing real quick, we need to, when I was going on a rampage about business, we need to bring business people into the conversation. They want to be there. They want to understand, and they want to be heard, because I think many times we're not doing that. And I just am frustrated is that we've got to make sure we keep them engaged all year, that the legislature keeps engaged all year, even as we have the budget fight. So I just want to assure everyone is that I will continue to be a champion for everyone. I'm not giving up. Hopefully I'll be here for 3.5 more years. And I love what I do. I will not be satisfied leaving this role if I don't have this childcare thing. We crack the nut better and open and get the meat of the information out. I can't wait for that day. So I want to thank all of you that are on the call today. Don't give up on us. I appreciate your advocacy. I appreciate when you come into our offices. This is the time for new policy. So I'd love to see any new policy. If I can't do it, we're going to give it to someone else.
Thank you so much. We greatly appreciate your leadership and continued efforts and insight for today, and how we can elevate the needs of California children, families, and providers. So thank you so much.
Oh, thank you so much. And thanks for everybody for being on the call.
Thank you. It's now my pleasure to welcome Bianca Blomquist, California Director for Small Business Majority, and Donna Sneeringer, President of Child Care Resource Center, to our next panel to discuss the shifting landscape of childcare access and the impact of childcare on the small business community. So that was a good segue of the Majority Leader talking about small business at the end of her remarks. I'll turn it over to both of you to introduce yourself and just provide a little bit of background. And maybe, Bianca, we can start with you.
Sure. Thank you so much, Kelly, and good morning, everyone. My name is Bianca Blomquist. I'm California Director for Small Business Majority. Really quick, just have to thank, of course, the Majority Leader for joining this important discussion today, to Unite LA for facilitating these conversations and connecting these dots between stakeholder groups. The Vietnamese American Chamber is amazing. I was so excited to hear that they were supporting this work. CCRC, Sierra Business Council, and the Pomona Chamber of Commerce. Thank you all for your work and investment in this discussion. So my organization, Small Business Majority, we are an advocacy organization with a mission to ensure that California's diverse entrepreneurs have access to the tools and resources to participate equitably in the economy. I'm here to talk a little bit about why small business majority approaches this issue in two different ways, and why this issue matters so much to the small business owners in our network. First, I'll begin by describing our network of small business owners. We represent 85,000 small business owners nationwide. The average size, though, of a business in our network has 4 employees. And this is important because business owners come in all shapes and sizes with different lived experiences, ideologies, et cetera. But what this group of entrepreneurs have in common almost always is a lack of a dedicated HR department to help them navigate all of these changes that the majority leader just outlined for you. Lack of access to legal expertise when they've been harmed by some of the market abuses in the industry, or access to capital issues that so many business owners face. And three, they tend to lack access to sophisticated tax planning services so that they can compete with other businesses in their local communities. So I just wanted to set that up briefly, and then to share that the two ways that we approach this problem from small business majority's perspective is first, from the perspective that from the perspective of employers and working families, right? 92% of the business owners in our network are actually parents, and nearly 60% of them say that they lack access to affordable, quality childcare that has kept them from starting and growing a business. It's also important to remember that 2/3 of our network are women entrepreneurs, and this issue is very different for women entrepreneurs who are oftentimes the primary caregivers in their family. And until they feel like they have those supports set up, they oftentimes do not jump into an entrepreneurial endeavor. Secondly, I'll flag that childcare providers are small business owners in their own right, right? Oftentimes, childcare providers, we describe them as providers, or sometimes even the childcare workforce, when oftentimes these folks are starting businesses and employing individuals of their own. And I think that that is one of the most important things that I'm hoping folks take away from this conversation. So since 2005, Small Business Majority has been working to engage to change this both the perspective that childcare providers are not small business owners, but also the perspective that small business owners aren't harmed by the lack of investment in this space. So I think really the question for me today is, is California ready to step up, right? We've heard about how the federal government is cowering down. And so I'm really excited to have this conversation with Donna and with you today, Kelly. So thank you.
Thanks so much for joining us. And thank you for sharing all that background. That's super helpful. Donna, I'll turn it over to you for a quick overview.
Well, and thank you, Kelly, for inviting me to join you all today. Thank you, Bianca, for being here, and also to the Assemblymember for her time. And she's been a tireless champion for childcare issues and for working women, and we really appreciate her. I'm Donna Sneeringer. I'm president of the Child Care Resource Center. We're a community-based nonprofit organization in Southern California. We provide childcare services along with a variety of other supports to help families raise healthy kids, and really build their families and our communities. So we, as I mentioned, provide childcare services. We do that in a variety of ways. We offer subsidized childcare services to assist low-income families in paying for their childcare. We know childcare is the largest or second largest expense often in family budgets. And for many families who are working, the cost of childcare outstrips their ability to pay. So we run a large subsidized childcare program funded mostly with federal and state dollars. We also are a Head Start grantee. We do a lot of training for childcare providers. We help childcare providers open their business. As Bianca said, childcare is a business, and they are trying to run their business and provide services to children, and very small cost margins, very similar to all other small businesses. And we do often forget that. We are part of a larger network of childcare organizations around California. In Los Angeles County, we're part of the Child Care Alliance of Los Angeles. There are 10 other organizations that provide services similar to what we do. And throughout California, we have been working through a network that we have started called Connecting California Families to really make sure that there are consistent services available throughout the state and that we're all working together to try to improve access and quality. We also do a lot of advocacy. We work in partnership with Unite LA on many things, including federal advocacy. Kelly and I have been in Washington, D.C. together in the past year, at least once, and we have more to come. And as we look at trying to navigate the complicated nature of our public discourse right now, whether that be federal advocacy or the state in response to federal changes, and how that then translates to local government conversations, it's really important to be a part of those dialogues and really welcome the opportunity to work with folks who are participating on this call to make sure folks understand the critical economic importance of childcare, not just to the individual family, but to our broader economy and to business. And families who are struggling with childcare have a hard time getting to work on time, have a hard time keeping their jobs, which creates turnover and all kinds of other challenges for the rest of the economy. And we've spent a lot of time trying to get folks to think of childcare as part of the infrastructure that's needed for our economy to work. So look forward to the questions and the conversation.
Well, we are grateful to both of you and to have we're honored to have your expertise with us on the webinar today, because I think you both speak to different parts of our ecosystem, but both really important. And I think to your point, Donna, like part of the whole infrastructure of how, we set up a strong economy. So before we dive in, any quick reactions to the majority leader's remarks?
I would just, one, she mentioned that she is the current chair of the Legislative Women's Caucus, and the Women's Caucus has worked on childcare issues in the state legislature for over 20 years. This is an area where they have spent a lot of time and a lot of political capital, and we really appreciate them. I was really struck by her concerns about affordability for Californians and the same families being hit by multiple changes, whether that's loss of different supports they've been receiving, or challenges with access to childcare, or seeing health insurance premiums go up. It's the same families who are being impacted over and over. And I thought it was a point well made, and I appreciated her desire to protect the commitments that California has made to its residents in light of many of the changes coming at the federal level.
Absolutely.
Would you like me to jump in, Kelly?
Only if you feel that's something you want to add.
Sure. Yeah, no, I mean there were a couple of points that the majority leader shared. I mean, she's absolutely right. I mean, here's what small business owners are telling us. Like, they support pragmatic solutions that recognize that childcare is a public good for us all. And again, to the majority leader's point and to Donna's point, small business owners employ roughly half of America's private sector workforce. They do deserve a seat at the table, but it is very difficult structurally to ask a small business owner, nonetheless a childcare provider, to take time on a Wednesday at 11 a.m. to go testify in Sacramento, which makes our work and our partnership that much more valuable. I'll also flag, I loved what she said about implementation. It is not enough for me to go to Sacramento and do fancy things and pass fancy laws and not then communicate those programmatic changes to the exact constituents that we instilled those provisions for. So I think that the educational component, especially for these entrepreneurs, is absolutely key, because they're oftentimes the very last folks to hear about the exact resources that were developed for them. And I'll also flag, Small business owners don't suffer from a lack of information, right? They suffer from far too much information. They don't know who to trust. They don't know where to turn. And unfortunately, authentic small business voices in Sacramento and in Capitol Hill are oftentimes drowned out by larger business interests. And so we want to make the case that the small business issue is a business issue and the business issue is a bread and butter issue. So yeah, really, really appreciate her comments there.
Thank you both. So, Bianca, I'll start with some questions for you. You've sort of touched on this in your intro remarks, but how are small businesses uniquely impacted by childcare challenges, and how might the impacts look different in different parts of the state, whether it's rural, urban, industry changes? Would love to hear a little bit about that from your perspective.
Absolutely. So I did mention in the onset, the vast majority of business owners in our network are parents. A lot of them, over half, say that they lack affordable childcare, and it's definitely impacted their ability to start a business, to grow their business. I would say, when employees of small businesses can't find care, these employers lose much needed productivity. I said in the beginning that the average size of a business in our network has 4 employees. This is actually the largest subset of small businesses are these very small businesses. And so when one person in a 4-person operation is out sick or taking paid family leave or can't find care of their own, right? The small business owner is acutely impacted by that. I'll flag, this should not be lost on most of the folks in this space, but we cannot have this conversation without intentional outreach to the most underinvested regions of our state, right? There's a reason California Forward is oftentimes in certain areas that many folks are not hearing from. These underinvested regions include the Inland Empire, the North State, where Sierra Business Council is doing some great work up there advocating for business owners, but also the Central Valley, local business leaders there. And I'll also flag, without getting too much in the weeds, but depending on where you are operating a business, also kind of changes the business climate and environment, as well as tools and resources that are available to you. So I think the work of the community-based organizations that are on the ground that understand the unique culturally specific needs of the community must be uplifted and brought into both the policy and advocacy space, but also the broader business, traditional business community.
Absolutely. I think those are really important points that you made. Donna, on a slightly different but related note in terms of industry, CCRC has been very innovative in how you've leveraged enrollment data to better understand the families you serve, including the industries that your families work for. Can you share a little bit about the findings from these analyses and what industries tend to rely the most on subsidies, childcare subsidies in your region?
Sure. So we, as I mentioned, run a large subsidized childcare program. We currently have about 66,000 kids in the northern Los Angeles County and San Bernardino County area that we serve. And for many years, we have used data and information about our families to tell the story to policymakers, to help them understand who families are that benefit from receiving subsidized childcare, who is waiting for subsidized childcare. And recently, we also have reinstituted looking at who the employers are of folks who receive subsidized childcare. And the way that we look at it is really looking at industry and sector, because there are industries that are more impacted by the cost of childcare and the types of childcare they need. So by far, the top area that families in our subsidy program are working is in the service sector. These are folks who are working in retail, restaurant, hospitality, and also in large logistics companies that try to get goods and services into communities. Working a lot with our San Bernardino community, we understand that they do a lot of logistics for all of Southern California. But what this means for families is these are 24/7 jobs. These are jobs that require them to be available every day, all the time, and their schedules often change. They may change week to week, and they've got to be able to find childcare that's flexible enough to meet their needs. So we're looking at care that's needed overnight, weekends, maybe not what you would consider the traditional day, school day or work day. They are really a part of that economy that, when you go out to dinner or when we're staying at a hotel, those are the families who are providing those supports and services. Probably closely behind them are actually healthcare. We have a lot of our families that work in healthcare, everything from in-home supportive services to hospital and medical offices, a wide array of different folks in those sectors. And we also see a lot in local government, which I think surprises people. But there are a lot of jobs within cities and counties that don't pay enough for families to be able to afford to pay for childcare. So those are some of the big groups. And we have been working with Unite LA, with the LA Chamber of Commerce, and then also with our elected officials to understand the interplay between people's employment and their need for childcare, talking about things like the pressures of the 24/7 economy. We've started to see more and more families who are participating in the gig economy that may be, driving or delivering things. And so, we are trying to have a good handle on who the clients are that we're serving, and then working to use that data and information to inform folks like the Assembly Majority Leader on what policies are needed and what types of services are needed.
Mm-hmm. Yeah, I think it's really interesting to highlight, the intersection of who is using leveraging childcare subsidies and where they work. And it's not explicitly a public-private partnership, but in many ways it is. So I think it's important to highlight that for policymakers. Bianca, you touched on this in your intro, but I think it's important to underscore that we do often lose sight of how family childcare providers are in fact small business owners. What support what supports could family childcare providers be accessing that they often underutilize? And what efforts has Small Business Majority driven to really increase outreach to in support for, family childcare providers?
Sure. Thank you so much. I'd like to just respond to something that Donna brought up. The majority leader mentioned that I think is absolutely critical. But Congress has before them a decision to make about what to do with these federal enhanced premium tax credits. And that's a long and fancy word for more money for middle class, low income and middle class folks to pay for the health care that they deserve and that they use. I'll flag that this is a major, major issue for California and for California entrepreneurs if Congress does not extend these tax credits. $2.5 billion a year to consumers will be lost. We're expecting, over $150 billion lost to our state budget. Some counties rely 30% on Medicaid funding, which I know is part of the HR1 conversation, but all of these federal decisions are compounding themselves in ways that completely stunt our ability to respond to these crises. So I just have to uplift that Congress must extend the enhanced premium tax credits for small business owners, the childcare providers, and all small business owners, as well as working families alike. But back to what I was saying before about the traditional small business ecosystem, I would like to see greater collaboration and greater outreach from the traditional business community to these childcare providers, talking about some of these programs that have been around for some time. So, for example, here in California in 2018, Small Business Majority was part of an amazing coalition to increase the technical assistance program funding from $3 million to $23 million. And what that program does, housed under the California Office of the Small Business Advocate, is provide funds to technical assistance providers, community-based technical assistance providers, as well as our SBDCs, women's business centers to put on culturally specific programming. And I'll flag that the women's business centers in 2023, 11 of 21 of them had ran childcare training. Over 400 businesses were served. 3,000 new slots were created as a result of that investment, and $1 million in small grants and loans were distributed. So coupled with Donna's amazing work and the amazing network of the CCRC, I really can't see a way how we can't work together and really be successful, even given the current budget environment, in securing these investments for small business owners. I will also flag that there are revenue generating measures that should be considered. We are not a state without money. Politics is about resources, who gets what and how much. And that is the job of our amazing leaders in the legislature and Governor Newsom to decide. But I would welcome folks to check out the California Budget and Policy Center's recommendations on what those revenue generating measures are, because we don't need to choose between childcare or SNAP benefits here in the Golden State.
I think you elevate really, really important points. And going back to the revenue conversation, that there are ways there are solutions to this challenge. And I think, how can we continue to make momentum on moving some of those forward? But I also think you raise good points about how are we leveraging different resources and funds, and I think elevating more partnerships between childcare and business and small business, because we have that infrastructure there. We just really need to make sure it's utilized and invested in. And so I think that those are all really critical things that you raised. Both of your organizations have obviously been involved in federal advocacy. Bianca, I know that Small Business Majority is very focused on the federal level, but also, as Donna, as you mentioned, CCRC has really stepped up its federal advocacy, especially in the last year. I'm going to pose this question to both of you, in terms of potential impacts of HR 1 and the ongoing appropriations negotiations. What are you seeing as some of the biggest challenges for advocating for childcare and public benefits in Congress, and making that connection point for policymakers? And what do you also see as some of the potential opportunities? And maybe, Donna, I'll turn it over to you first.
Sure. So I think, as Bianca mentioned, much of the spring and summer this past year was really spent talking about HR 1. And we, though, our childcare is our core business, understand deeply that the tremendous reductions in Medicaid and reduced access to food benefits impact our families. They impact our childcare providers, they impact our hospitals. And so we really were leaning in with our advocacy efforts to try to lift up how all of those things are interconnected, and that it's often, as I said, and the Assemblymember said, it's the same families. That you start to have this compounding effect of these different reductions. And, whether it's having your health insurance premiums go up significantly or losing your Medicaid benefits altogether, the care need is still there. And what that ends up doing is putting additional pressure on our healthcare system, our hospitals. And so we really were working a lot on that. As far as childcare goes at the federal level, there's been a good amount of bipartisan cooperation around childcare. There's a general understanding that this is an issue that does impact business, it does impact families. And so we have had some interesting conversations across the aisle for many, many years. The appropriations packages that moved forward had some small increases, proposed in the Child Care and Development Block Grant and in Head Start. Not significant enough that they would impact increasing service, but I think it is in a time when most things were not being increased, a sign of the understanding and commitment to trying to make some headway in this area. So, I think we continue to try to lift that up as a place where folks could come together and work on how they're going to do that. And the other piece with HR1 is that they did add in some business tax credits. So that's another piece.
Sure. So I won't spend too much time on this because I really recognize CCRC as the star of the show on Capitol Hill when it comes to ECE. But from our perspective, from Small Business Majority's perspective, I'll flag that, any opportunity not to increase funding for Head Start, TANF, I mean, they directly impact childcare access, and they put providers out of business when those investments are not keeping up with what is going on in the economy. And to that point, before I make that point, in rural and underinvested communities, folks have far fewer choices. There's far less competition in the marketplace. So these kinds of investments fuel that kind of growth, fuel that competition that we know that we need. I'll also flag that we got a wage problem. And the wage issue cuts across both crises, right? ECE professionals make far less than some of their K-8 median wages counterparts. The current rates are not a driver for folks to start a family childcare or daycare center in California. And low provider wages, low wages in the childcare workforce, all of these things provide or incentivize a downward pressure on wages and benefits for the individuals who need them the most. And we need more childcare slots. We need providers and childcare workforce that is invested in, that is healthy, that has wealth building options for their family. So I will flag that the reimbursement rates are a big part of that conversation, and not sure if that will come up today, but did want to mention that.
No, thank you for elevating it. It is a little bit of an elephant in the room that's happening, or that's been a huge advocacy priority for several years. We are almost at time, probably about 30 seconds. I guess I just want to turn it over to both of you. Any final closing thoughts or things that you really want to underscore from today's conversation? And I don't know, 20 seconds or less. No pressure.
20 seconds or less. I just really encourage everyone to work collaboratively as we go into the federal and state policy conversations next year. I think, Bianca, you and I've got some work to do to partner up on how we can leverage our resources, and just really appreciate everyone's attention today.
I will jump in and say thank you so much for including our perspective here. And I'll just flag, we anticipate the reimbursement rate reform issue not to go away anytime soon. We've been pushing for reimbursement rates in every budget cycle since I think 2019, and billions more are needed here. So we'll continue to advocate in that space. I mean, Connecticut just invested like $300 million into their ECE workforce. So California has an opportunity to lead here. We're the best state in the country. We can do this. We're the innovation state, and I'm really excited to see what Donna, Unite LA, all of us participating today can do together in 2026.
Well, thank you both so much, and thank you to all of our speakers today. I think this has been a really robust conversation at a really critical time, and so thank you all for your leadership on these issues, and looking forward to continued partnership to elevate this as a priority in the years ahead. And thank you to everyone that participated. We will follow up with a recording and look forward to participating in more of these sorts of webinars in the future in 2026. So thank you all so much.